Hi, it's Dr. Rick. We're talking about feet today. This is a model of a foot. This is the inside of a foot. This is the front, big toe, small toe. This is the side, the outside of the foot. These are metatarsals, these are tarsal bones, and then you have the ankle bones. The tiny fibula on the outside, which most people will roll, break, or strain with an ankle sprain, and the big tibia on the inside, which can take a lot of pressure, but if you break it, you can't be weight bearing for a short time. Then you have the heel bone. You can see how the outside with its tiny fifth toe and the inside with its big arch are different. This arch is made to be a shock absorber for when you come down. When you come down, usually it's a heel strike and then a toe off. Heel strike and then a toe off. So the fact that you have an arch here, some people have high arches, some people have flat arches or no arch, but depending on your type of foot, you should purchase the right type of shoe. Whether you're a runner or whether you're a cross trainer, whether you even just do the elliptical or lift weights, it's important that you wear the right type of shoe. It's even important that you wear the right type of shoe for the type of work you do. This is the foundation that is in contact of all the body parts. This is the one that contacts the ground the most. And whether you sit all day or whether you are on your feet or driving, it's important to wear the right type of shoe because this has to take a lot of impact. If this is flat, then the feet will hurt, especially at the end of the day. Toes will go into the front of the toe box. You'll have pain to the nails. Even after a 7-mile hike, if it's hiking downhill, your toes are always going to slide forward. There's going to be a lot of pain with each step after about the 5th mile. If you are a runner and you run a half marathon to a marathon, the foot will enlarge, it'll swell slightly in the shoe, and it's going to hurt after a while. So it is important you get the right type of shoe. You have to have the right diagnosis, or somebody has to evaluate what kind of foot you have. That's either done with me, a sports medicine doctor, a podiatrist, doctor trained in foot surgery, or an orthopedic surgeon that is trained in foot and ankle surgery. I think a lot of my runners will also know how to assess, especially the coaches know how to assess what type of foot you are, what type of heel strike you go through, what kind of heel whip you go through. They usually will put you on a treadmill with your favorite shoes and film you and watch you in pretty decent form. So it's important that you go to the right place. In Illinois, we have a couple of stores under franchises, but they're called Dick Ponds. I like these guys. Most of them are runners. Most of the employees are runners. I've always shopped with them. I give some lectures in the Lyle Dick Ponds, and I think they serve the community nicely. But the bottom line is that they actually have runners who are invested in telling you what type of foot you have, what kind of walk you go through, running you go through, and then suggest the type of shoes to buy. Now, they usually have a wide variety, but you have to have a wide variety to have a good selection. Sometimes you can actually go to them, get the assessment, go online, and then see if you can get it cheaper. That's the wisest thing to do. But the reason I'm talking about foot problems is because this being the foundation, if your foot is wrapped in something that's cheap, you can actually, with each step that you take, from the first step in the morning to the last step before you get into bed, you can actually impact and send force into the knee, the hip, the back, the pelvis, even the neck. So it is important you treat these things right. A common problem that we'll have in the clinic is older people that have swelling to this, the first MTP, the first metatarsal phalangeal joint. It'll be swollen, it'll be red, it'll be painful, so painful you can't put your sheet on it at night. And for those of you who have this condition, usually you'll know that your doctor probably diagnosed you with gout. Without a blood test, without taking any fluid out of the joint, the diagnosis of gout usually leads to using an anti-inflammatory, maybe a steroid for a short burst, quieting down the swelling, and getting off your feet for a short time. But if it doesn't go away, then you'd have to be on stronger medicines for gout, and at that point in time, that's when you really should have the workup. I've had a few patients come in with swollen first MTP, and they did kind of okay with anti-inflammatories. They kind of needed a steroid every once in a while, but they went, because they didn't respond or it came back again, the doctor put them on colchicine, which is not a problem, but before going to specific medicines, it would be nice to have an exact diagnosis. You can get the best diagnosis is to pull fluid out, look at it under the microscope, and you see something called birefringent crystals. Half decent, if you don't want to have anybody poke you with a needle in that swollen joint, a half decent test you can do is blood test to look for uric acid. Sometimes it'll be high, sometimes it'll be normal. But those two are important. If you don't have those two and you just kind of, if the doc's just treating by the seat of his pants and assumption, I think it's important to always look for another cause. The reason being, I had somebody that came in, fractured the big toe. I think he jammed it into a piece of wood or something. Fractured the big toe, a big runner, big cross trainer, and it just so happens he never had any problems before, but when the toe healed up, he started getting first toe swelling. Now, I don't think this is a guy that's very healthy. He has a decreased amount of meat, essentially the Mediterranean diet, does a lot of exercise. I don't think this is gout. I think that the fracture he had to his big toe changed the dynamics of the way the rest of the foot worked. When you have a fracture of a toe, let's just say this one here, the first MT. If this is fractured, it will usually heal up nicely if you're healthy, don't smoke, not obese, eat properly. It'll usually heal up almost exactly the way it was before the fracture, as long as you obey the rules and don't hit it all the time while it's healing up. Now, the problem is, like anybody who's broken a bone before, sometimes there's this sensation that with the callus that forms, it's more sensitive than any other bone in the body. People will say, I know it's going to rain because my old fracture is bothering me now. And sure enough, in 2 days or 3 days, it rains. So there's something to be said about the barometric pressure or old calluses being more sensitive than before the injury. So I do think that when you have an injury anywhere along this dynamic line of toes to arch, to tibia, to knee, on up, if there's a change in any of the points of interface, you're going to have another change down the line that's greater. So it is important to consider other possibilities. In this guy, I don't think he had gout. I think somebody should be looking at him and his foot planting and his shoes to see what's changed in his gait since before his fracture. They probably looked at him before. They know his gait, they know his heel, they know his movement. I bet you he needs a different set of shoes now, or I bet you he needs taping. Sometimes the other thing too is when you fracture, it takes about 6 to 12 weeks to heal up. That means this guy didn't hit for 6 to 12 weeks. That means this joint was stiffened. And if you didn't go to physical therapy, which sounds funny, physical therapy for a little joint or physical therapy for a little finger, but it is important because it's part of this dynamic chain. So if he didn't go to physical therapy, he probably has a stiff toe. There's something that happens with guys who practice on AstroTurf for the first time ever. It's called turf toe. It's because of excessive irritation. Well, the joint always tries to protect itself by stiffening up to tolerate the excessive irritation. So if this guy has anything like a turf toe, he is probably not having a flare-up of gout. He's probably having a flare-up of any irritation in the joint. And this is also important for my older guys. I'll have older guys who may truly have gout when they have that toe flare up or the ankle flare up, but it could also be that something else, as you get older, is changing. So somebody really should assess that person, take the shoes off. If somebody evaluates you for gout and doesn't even look at the skin, forget it. They're shortcutting you. You have to at least look at the toes, the naked foot, the naked shin, and even, for me, I would do the knee. There's something called a Q angle. That's the angle that goes from here to the middle of the knee to the hip. I'd look at the entire area, put the person in shorts and make sure everything is good. Because you can also have problems above shooting down. So it's important to look above and below the joint that's giving you the problem. It's important to look at the gait, it's important to look at other things going on in the patient's life. Bottom line is it's important to have somebody that'll brainstorm, that will be with your best interest to figure out not just, hey, it's gout, here, take these 2 medicines, call me if it doesn't change, but also to look into it further, especially if it's not going away or it keeps on coming back. To shortcut a diagnosis if you're in a hurry, yeah, just go ahead and take the medicines for gout, but if you want to be on medicines, even if they're over the counter, you really should come up with a exact reason, best possibility, work it up as little as possible as long as it's not too expensive or doesn't cause too much intervention, and then you treat. If it keeps on coming back, you have to have more of an exact diagnosis. Don't just take medicines. And there are other things you can do supplemental, glucosamine sulfate, turmeric for inflammation. Sometimes you can take devil's claw, white willow bark, and then other things depending on the other problems, topical if possible, but orthotics are really the key here. Taping, if before you get the orthotics, can be done by a good physical therapist. That's called dynamic taping, but eventually you'll have to fix this or train the foot to tolerate a gait different than before.